Hi friends, suicide prevention. Today we will discuss about myths and facts. I'm Dr. Suresh Bharatmat, Professor of Psychiatry, Head of Telemedicine Center, Head of Forensic Psychiatry Services, NIMANS, Bangalore. So we'll discuss today about myths and facts about suicide. Myth number one, talking about suicide, inquiring about suicide, asking someone if they feel suicidal, preempt them to attempt or commit to suicide. The fact is, people contemplating suicide are seeking for help. They are ambivalent. They are worried about the stigma, what the people will think. They are also worried how the other person reacts. So, please do not hesitate to ask. Asking, inquiring proactively gives a window of opportunity to intervention. Myth number two, people take their own life are always impulsive. The fact is, only small proportion of the people who are impulsive will attempt suicide. Majority of them are not. So majority of the suicide have been preceded by giving warning signs. It may be verbal, non-verbal, or behavioral signs would have been given. So majority of them do not commit suicide because of impulsivity. Coming to myth number three, young people who talk about suicide never attempt. The fact is, studies have clearly shown that if whoever has completed suicide, if you inquire about their past, they would have at least 30 to 40% would have attempted 3 to 4 suicide before they have completed it. So don't take it lightly. If people are talking about suicide, this is an opportunity to prevent it. Please do proactively do something. Myth number four, people who threaten suicide are just seeking attention. The fact is, they are seeking for help. Suicidal attempt or suicidal talks are desperate cry for help. Please don't challenge them. If you challenge them, they may complete suicide. This is an attempt to help. Please don't deny help. Don't challenge them. Coming to myth number five, the only effective intervention for suicide comes from psychiatrist. The fact is, every citizen has a role to play in preventing suicide. Of course, psychiatrists do come in the way of providing help, but they are in the last. They will provide help if a person is suffering from severe mental disorder. Otherwise, the society at large should do prevention of suicide. Coming to myth number six, all people with all people with thought of suicides are depressed or mentally ill. The fact is, not all people with suicidal thoughts, ideas, or attempt are mentally ill. Similarly, all mentally ill do not commit suicide. Hardly 10 to 15% commit suicide. Remaining, there are many reasons and thousands and lakhs of reasons are there to attempt suicide. So, saying everybody are mentally ill is completely wrong. Myth number seven, all suicide can be prevented. The fact is, all suicide cannot be prevented with certainty, but identifying the warning signs, proactively asking, looking for risk factors, definitely we can decrease the prevalence of suicide in our society. And majority we can prevent, but there are in minority, yes, it is difficult to prevent. Coming to myth number eight, children do not attempt suicide. In fact, they do attempt. Invariably, it will be copycat suicide. The children by the age of 8 to 10, they will realize the difference between death and suicide. They also understand the concept of death. So invariably, immediately after the exams, if there is a failure, the suicidal attempt may be there. That may be they are that during that period they are a high risk. So I request all the parents before the exam, instead of asking, what will you do if you pass? Prepare them. What will you do if you fail? How will you face the world? If your friend fails, how will you deal with him or how will you talk to him? Prepare them for the failure in life. It is not always success. There are some failures. Everyone faces failure. So, failure is the step for success. So, please prepare your children for failure and how to face failure and how to overcome failure. Myth number nine, People who want to commit suicide always find a way. The fact is, suicidal attempts are desperate cry for help. They are always ambivalent. They are contemplating. They are worried about stigma. Please try to help them. This is the opportunity to help them. Myth number 10. If a person attempts suicide and survives, they will never attempt in future. The fact is, often they attempt. The studies have clearly shown that if a person has completed a suicide, if you check for their past history, around 30 to 40% have attempted in the past and they have failed. So, the people who have attempted are at the higher risk. Myth number 11. Suicide attempts or death happen without warning. The fact is, usually they give warning signals in the form of either giving indications by verbally, non verbally, or behaviorally. So, thank you. Thank you for your valuable time. And please do remember, every person, every citizen has a role to play in prevention of suicide. It is you and me. Let us pledge to prevent suicide. Stay safe. Thank you.